Hi, my name's Dr. Ross Cutts and you're watching my video of me placing a Straumann BLX implant in the upper left 6 region using a small Summers technique. So here we're doing a little crestal incision, and then we just very simply elevate the soft tissues. We utilise anaesthesia, so patients, as you can see, are very numb. Here I can use actually just a little one of the drills from the sequence of the BLX protocol to work out dimensions for which size of implant to place. And we're going to put a 3.75mm BLX in here, so that gives us plenty of mesiodistal bone. This is our pilot drill, which runs at 800 revolutions per minute, and we just do a small little pilot just to get angulation, and then this is the next drill in the sequence. Start with a slightly slower drilling speed, and then up to 800, straight line drilling. And of course, as always with implants, with all the implant pieces, we're checking the angulation, but we're also watching the back of the throat because we don't want to drop anything down there, as you can see from the video. And so we're just checking for angulation for the screw retained crown. We're quite close to the sinus floor as well, so I'm just checking for a good apical stop and length. There you go, you can see the back of the mouth there. One way to minimise that is to just get the patient to close ever so slightly. And so now I'm going to go to full depth. This is going to be an 8mm fixture with a small little Summers lift. And then the next drill sequence, just to widen the osteotomy site. Again at slightly slower RPM, 600 RPM. This is my little osteotome, and then we can just check that we've got a good apical stop. This is a Straumann osteotome from the Straumann osteotome kit. I've had it years, fantastic bit of surgical instrument. You can see the 3.75 diameter implant sits beautifully in this crest with good mesiodistal bone as well as buccopalatal. And then this is the final drill in the sequence. We notice we're going straight line access, straight in, straight out. Down to depth, we just check to see that there isn't a perforation. This is our implant in the carrier, and then we just hand place the fixture into place, into depth, and you see it's just, type 4 bone. Take the carrier off, check that it's in a good position, and then if we need to, just a couple more turns to make it just like 1.5 mm subcrestal. Check the direction. See, it's still excellent angulation for a screw retained crown. This is my chosen prosthodontics. My assistant with excellent aspiration, and then a nice healing abutment to go on to make, for transmucosal healing, to make it nice and straightforward for the prosthodontic phase. And that's it, and that's our implant in place. Very straightforward. Very straightforward. Excellent primary stability with the BLX implant. And then just a couple of very simple little sutures, just mesiodistally, just to tie it together. There we go. Very, very simple. It's got a lovely little drill sequence, good primary stability, and it's quite a great implant for type 4 bone, where bone is less dense, so primary stability can be potentially compromised a little bit. The flutes of BLX offer excellent primary stability, and then that's the site closed. Very simple, straightforward case for an implant placement. Hope you enjoy the video.